Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is the co founder and CEO at Concert Health, Spencer Hutchins. How are you today?
I'm doing great. Thanks for having me on.
Excited to have you on. Let's dive right in. Tell me a little bit about your background.
I've been trying to make a difference at the intersection of healthcare and technology for pretty much the last 20 years. So, Concert's the second business I founded and led. Earlier in my career, I worked at a family office doing Series A, Series B investments in the same space. And way back when, I was a management consultant, serving both technology companies thinking about healthcare strategies and vice versa, and would take periodic breaks to do public service work. So I got to spend some time in the first term of the Obama administration helping start a healthcare team at the Federal Communications Commission.
And what led you to, obviously you throughout your career you like to have impact. What made you want to start Concert Health in particular?
Yeah, like everybody with a pulse, I've got a such close family and friends that have experienced mental and behavioral health conditions and have seen how transformative great care can be and how easy it is not to get it in this country. And I've done a bunch of building organizations that were fundamentally software businesses and had come out of that realizing that it's rare that it's just the software that needs to get fixed, right? Maybe the software stinks, but it's the teams, the culture, the clinical models, the operating models, the business models that all need to come together to make something work. And I stumbled upon a research base around the care model that Concert Health is based on called collaborative care, and was just fascinated by the concept of integrating behavioral health services into the primary care setting, how much sense that made, and how much overwhelming evidence there was in existing randomized control studies. And one thing I learned along my entrepreneurial journey was it's pretty difficult to make new science and scale new science at the same time. You need to pick one lane, and I'm not smart enough to make any new science. So this felt like a moment in which I discovered something. I was 15 years late into it. This is 2016. The original studies were in the early 2000s, but was just fascinated why no, this hadn't scaled yet, and became, frankly, professionally obsessed with that long enough that decided that I wasn't going to give up unless I started a company and found a way to try to bring it to more Americans.
So you said the research has been out for a while now. Why do you think it wasn't? Like obviously there's still an opportunity for you to want to get into this space. So you
Yeah,
mentioned part of it was because it wasn't already solved. Why? What do you think some of the blockers were that no one was really
sure.
able to figure it out to this point?
So the care model that Concert's really been um, focused on scaling was originally called the impact model. That was the name of the first study, and now it's called collaborative care. The basic idea is a group of psychiatrists at the University of Washington that recognized a few fundamental truths: that there weren't enough psychiatrists, nobody wanted to come see them, and it was a really silly idea to separate depression and anxiety care from everything else that happens in our lives and bodies. It's all integrated. And they ended up inventing and then beginning to study this care model in which you embedded two clinicians, either in person or virtually, into the primary care team. A collaborative care clinician, or we use all master's level behavioral health providers, and they can really join the PCP's team, the primary care physicians team, to help take quick referrals and do a mix of therapy and psychosocial interventions. But different than regular therapy, what they do is also are accountable for tracking outcomes, tracking symptoms over time, and then meeting once a week with a psychiatric provider, reviewing the cases of people that aren't getting better and problem solving, either a new approach in psychotherapy or the psychiatric provider making a recommendation to the primary care provider. So not a referral away from primary care, but an extension of primary care, really helping them do a great job managing a spectrum of depression, anxiety, and other conditions, which can be really effectively managed in primary care. So in 2016, I read that original study, which was the patient care happened in the late 90s when I was in high school, and in the early 2000s, published in the early 2000s. And there's been something like 70 or 80 papers since then that had replicated, and it showed that it worked better. It addressed more patients more effectively than primary care could by itself or outpatient behavioral health could. And it drove superior outcomes, both in how it could control depression and how it could control other or impact other chronic diseases, whether that's obesity or diabetes, things that are putting you in the hospital or emergency room. And that's the model. And in 2016, it had been replicated a lot in research, a lot with grant funding. And there's kind of two reasons it hadn't scaled. One was the money didn't work, right? So primary care, psychiatry, therapy, they could all get paid separately, but they couldn't actually get paid to work together to do this model. And the second is it's kind of hard to do. It's a different protocol. It's a different model. It's a teaming across three different disparate groups of clinicians that's a little different. And so no one had really dedicated it. The problem number one, then the reason I started Concert was that Medicare fixed the money. So they actually created a reimbursement schema that allowed any primary care physician to deliver this care model to their patients across the country, and they could actually get paid to do it, right? It would become part of a covered benefit for Medicare. Fortunately, pretty quickly after Medicare, virtually every health plan on the commercial market followed. And at this point, about half the states Medicaid has. So we've really, at Concert, we've hopefully played a small role in helping accelerate that through our advocacy. But that kind of was happening on its own. Concert was built to fix the complexity, right? Because it's a new benefit, but most primary care groups didn't know. And even if they found out, are not dying to learn about a new payment model, a new clinical model, hire loads of social workers, find psychiatrists to work with, put it all together. And so when we canvassed the market back in 2016, 2017, when we were in the idea phase, and it felt like there was a huge opportunity that finally there's actually a sustainable way for medical practices to deliver this model, and it'd be the right thing for people all across the country. And when we saw in the innovation space, a lot of people making apps or workflow tools, and we just didn't think that's what the market needed, or wasn't the only thing the market needed. What the market needed was a high-performing employed group practice that could actually be a great place for the best behavioral health clinicians in the country to work, and could really operate as an easy button for high-performing primary care teams that wanted to do this in a partnership model as opposed to figuring it all out themselves. And so since then, the rest has been history. We started in suburban Phoenix, working with some small practices, many of whom we still work with, almost all of whom. And now we work with over 4,000 primary care providers, and we're practicing medicine across 17
I
states.
like that. Easy button. It's immediately the mind goes right to the easy button that you give people for their desk. That's really cool.
Yeah,
Talk me through some of the key differentiators that you see between I mean you within what we've already discussed.
sure.
I've already kind of heard some, but let's signal a few out for the
Mm-hmm.
audience. Versus why someone would use your behavioral health company versus
Yep.
someone else.
So you can think of a few layers. One is channel, right? So there's other organizations that are focused on direct to consumer, right? Getting people on the web or brick and mortar. Others focus on employers, right? Being a benefit that you sell through. We really focus on that partnership with primary care. That also means that we have the ability to care for people with Medicare and Medicaid. Those have represented 55 or 60% of the patients we've cared for, and a real opportunity to serve all Americans in need, not just those with the right employer or the ability to pay themselves. The second area is sort of structure, right? I think a lot of people are building just software, or they're trying to become a marketplace. They're taking independent clinicians, matching them with independent patients, and being there around a marketplace or a network. Our view is to really focus as an employed group practice, right? So that most of our clinicians are W-2, we're always their main job, and really about training, creating great careers for behavioral health clinicians. And the third difference is really the insight of this care model, right? Using the evidence around the specific modality, collaborative care, which is really focused on one, empowering those primary care providers, OBs, pediatricians, oncologists to do a great job with them as the quarterback, and us there supporting through our behavioral health interventions, and our psychiatric providers there making recommendations on helping the PCPs diagnose, prescribe, and treat better, as opposed to taking over their care. We're really passionate about that because 80 papers. It's now closer to 90 that say that care model works better. It's also, I think, the only evidence-based model that has a hope of actually caring for everybody in need, because we know, there's a lot of great psychiatry organizations, telepsychiatry, other things which can do great work, but there's simply not enough psychiatrists to manage everyone with depression and anxiety. We need to empower those clinicians that actually sort of have enough reach to help all of us, and those are our primary care providers.
Now, when a lot of guests come on, Spencer, I ask them to pull out their crystal ball and try to paint me a picture of what the future could look like, in their particular space. So, when we look at what the future of behavioral health looks like, through the concert health like lens, through your
Sure.
lens, talk us through what that looks like, and then maybe where you see future in the future concert health's impact on behavioral health.
Yeah, so I'd start by saying how wonderful it is that as a society and as an industry, we finally started to try, right? In reality, up until 1 or 2 decades ago, we didn't really have a national aspiration that everybody with behavioral health conditions should get high quality access to high quality care. Um, and so that's wonderful and it's great. I don't think we're not going backwards on that, right? That the tide is coming. There's a recognition, awareness at all levels of all of us in our families and our lives. We're reckoning with it. We're talking more about it openly, and as a healthcare system, we're realizing this needs to be a core part. We think the future is really centered in primary care. And so the definition of high quality primary care is going to include the majority of supporting people with depression, anxiety, and a host of conditions. One, because those are almost always linked. They're interwoven with our diabetes, our lung failure, our obesity, right? They're causing one another, right? They're cycling in bad ways, and it's our primary care providers that have the capacity, insight, and relationships to drive that. And so we're really believers that behavioral health at its core will not continue to act like a specialty industry off on its side, but that the majority of it will be enabled by high quality primary care. We think that is the way to get access and quality. It's also going to be one of the key several levers of helping our primary care teams transition to whatever jargon we want to use, value-based care, this idea that they're going to move away from just getting paid for every visit to having their revenue model more aligned with long-term health of the populations, the people they manage. And to do that well, we think this embedded collaborative care model or other behavioral health integration is going to be critical. So what does that mean for Concert? It is incredibly exciting that we've cared for well north of 50,000 patients to date, but there's probably in the order of 30 million Americans that need care like this and already have a health plan that will cover it. And so I think we need to be humbled, inspired by the work we've done, but humbled by how much is left to do. And there's just a lot of growing. It's a lot of being a great employer for great clinicians, hiring a lot, deploying a lot against our current partners and new partners. And then while this care model is, I think, going to help and be the right way to treat 60, 70, 80% of all the people with behavioral health conditions, they'll never need to see specialists, right? They can be effectively managed in this stronger primary care team. But I think another aspect of all of our responsibility and Concert's responsibility as an organization is sort of organizing the specialty system behind us, understanding those people that do need to get to specialists and finding the right ways to step up care into those programs and step back down into a primary care setting so that we're really using the scarce resources of our facility-based work, our high acuity programs, our specialty programs for those that really need it.
And in terms of not just future, what's next for Concert Health that you're really excited about that you can tell us here today?
Well, I'm just so honored by several of the partners that we get to work with of all sizes. So a few, Mercy Health, the biggest health system in Missouri, with Oklahoma, and then large operations in Oklahoma and Arkansas. Advent Health, based in Orlando but operating in the United States, and just incredibly humbled and impressed by their and dozens of other groups like Common Spirit and Trinity, and regional systems and medical groups across the country. Just inspired that they've given us the opportunity to say this is how we want to do care. But many of those organizations have over 1,000 primary care providers on their team. And so the opportunity to really make it build systems into it to screen patients, because we know only about half of the people with depression raise their hands about it, and really get to everybody, and do that by empowering and making those primary care providers better. It's growth for Concert. It's changes on the side of our partners for screening and training, and really being a part of that and saying those organizations that have responsibility for caring for hundreds of thousands or millions of people, that we can really be their partner and reach those scales with them, and continue to generate evidence, which we can share with health plans, we share with patients, and we share as research as a way to keep building on this, so we have a chance at actually figuring out how to get everyone into care that needs it, and everyone better that's into care.
Last question for you before we wrap up here. Something new that we're doing. What was a favorite show and or movie of yours growing up?
Well, it was a little bit older than growing up, but I remember I fell in love with The Wire. That was in, I think, late college and grad school when I watched that. Still, I think, just an amazing social commentary, amazing writing, amazing acting. Fell in love with it. I've watched every episode at least twice.
I love it, and I can tell you like it because you smiled immediately when you started thinking of it. So I actually haven't seen that. So I mean, I've heard it compares well with like The Sopranos, though, in terms of like,
Yeah,
if you watch The Sopranos, you would like The Wire. So I still need to check out The Wire.
totally. You've got to, if you're not from the Baltimore area, you got to give it a couple episodes, because that's where it's based, and they got a pretty thick accent that takes you an episode or two to start to understand. But it's worth getting over that hump. That um, yeah, everything about it was captivating. I remember binge watching it back in the day.
I'll have to check it out. Well, Spencer, thanks so much for joining me here today. You were great, and wish you and the Concert Health team all the best of luck.
Thanks a lot for having us on, Jared. Really appreciate it.